Just some housekeeping items. This virtual meeting is being held in accordance with Public Act 2020. As such, during the attendance, all commissioners are required to provide their location, the city, county, and state of which they're participating in. Also, a requirement of Public Act 254 is all votes will be conducted by roll call. The meeting is being recorded. However, if you in the public would like to record the meeting individually, please indicate so by using the Zoom raise your hand function or just waving at us, and you'll be enabled to record the meeting on your own computer. I do want to mention that while the meeting is being recorded, the official minutes, the minutes of the meeting will be the official record of the meeting, and the minutes are kept with the county clerk. A couple other items before we get started. We do have call to the public. There are two call to the public sessions, one towards the beginning, one towards the end. During call to the public, it is an opportunity for citizens to address the board for up to 3 minutes in each session. All that we ask is that individuals provide their name and address. And then lastly, I want to mention that the call to public is your opportunity to present important information or information you feel is important to the Board of Commissioners. It is not intended to be a two-way conversation. I also want to say, this is a special meeting. I want to clarify something because there have been some questions. You know, I, as the chair, as an individual, I do not have the authority to call a special meeting. That is in our board rules. So any three commissioners can call a special meeting. This particular special meeting was called by Commissioners Plank, Zajac, and Drick. That's all a matter of public record. So I just wanted to clarify that point. As we get started, if you would join me with a moment of silent reflection. Thank you. Now let me get my flag here. And if you would join me in the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Roll call, please.
Commissioner Nakagiri.
Present, Heartland Township, Livingston County, Michigan.
Commissioner Griffith.
Present, participating from Genoa Township, Livingston County, Michigan.
Commissioner Lawrence.
Present, participating from the city of Brighton, Livingston County, Michigan.
Commissioner Reeder. Commissioner Reeder, you are muted.
Present, Deerfield Township, County of Livingston, Michigan.
Thank you. Commissioner Helserman.
You're on mute, Commissioner.
I'm sorry. Present, Doug Helserman, present from Handy Township, Livingston County, Michigan.
Thank you, Commissioner. Commissioner Drick.
Present, City of Howell, County of Livingston, State of Michigan.
Commissioner Zajac.
Present from Delhi Township, Ingham County, Michigan.
Commissioner Gross.
Present, attending from Green Oak Township, Livingston County, Michigan.
And Commissioner Plank.
Present, participating from Green Oak Township, Livingston County, Michigan.
A quorum is present.
Thank you. Item 5 on the agenda is our first call to public. Before we start the call to the public, I would like to make a couple of statements. One, I didn't do the best job I could have done and called the public last meeting, but I want to mention the following. Everybody's entitled to their point of view, and that's great, and you can voice your point of view. But if you have criticisms that you want to direct towards the boards, please direct them at the chair. I represent the entire Board of Commissioners. If you have issues that you want to berate the Board of Commissioners about, I would ask that you in the public direct them to me. Also, I want to mention that to expedite the meeting for our county officials that want to address specific issues with regards to reconsideration of this resolution, I would ask that you do that during the call to the public. I'm going to, I would never cut off another commissioner, but I'm going to ask, the discussion tonight, it's been thoroughly discussed. I would like to streamline things and have the commissioners, elaborate on their position on, whatever on the issue, and then thus minimizing the back and forth. Therefore, if you're a county official and you want to say something, please do so in the call to the public. Our Chief Financial Officer, Cindy Katnick, will be unmuting individuals during the call to the public. So if you wish to speak at call to the public, please use the raise your hand feature to indicate your desire to speak. Or if you can't find the raise your hand feature on Zoom, please just wave at us and Cindy will call on you. With that being said, I'll turn it over to Ms. Katnick.
Thank you, Commissioner Nakagiri. First one up is Brian's iPad. You should be able to unmute.
Okay, can you hear me now?
Yes.
Okay, thank you very much, Commissioners. My name is Brian Rakuta, 7287 Fawcett Road, Benton, Michigan, Deerfield Township. I also am the chairman of the Livingston County Planning Commission. And just for consideration for tonight, I just want to, I'm curious about how meetings would be handled and whether you've considered that and how that's going to be addressed. It's my understanding we'd be limited to 25 people. Most meetings, this would not be an issue, but occasionally we get 50 to 100 people, and how that's going to be handled, whether we have to do temperature checks and all the details. I'm curious about hearing about how that's going to be handled if you overturn your last week's decision. I also, I believe the state act doesn't allow for it, but I think it would be helpful if we could have a hybrid option, if that is an option. I don't know that it is under the current regulations, but I've talked to most of the commissioners on my board, and we've got people who are in different places on this subject, and at least having a hybrid option would allow us to have participation by all my board members. I'm not sure I'll have participation by 100% of my board members otherwise. So.
Was that it, Brian?
Yeah.
Thank you.
Okay.
Okay. Caitlin Perry. Hang on just a moment. Okay, you should be unmuted.
Yep, I'm unmuted. Thank you for the opportunity to speak tonight. My name is Caitlin Perry Dial. I live at 634 Nelson Street in the city of Brighton. I am also here speaking tonight as a Brighton Library trustee. And I urge you to keep the emergency declaration in place. Like many in this meeting now, I watched the vast majority of debate during last week's meeting and was very much relieved that reason prevailed among this commission. It seems that we have two factions at work here. One faction who sees reason and understands that this emergency declaration provides the ability for the county's public business, as well as smaller jurisdictions within this county, like the library, to operate virtually. The other faction is willfully acting against all reason, citing freedom and liberty as their reason to force in-person public meetings during the global pandemic. Virtual public meetings are more accessible, and this should be celebrated. Virtual public meetings allow for greater participation in our local government. So how is this a bad thing? Single parents with small children can now participate from their homes. Those with hearing and visual impairments can use their adaptive technologies to connect directly to these meetings. Again, how is this a limitation on democracy? It seems to me a great expansion on it. By rescinding this order, you have now caused more taxpayer dollars to be wasted by meeting, planning, and implementing in-person meeting plans when you know room capacities are limited. It seems to me that this commission does not want greater access to liberty and democracy. They want to limit it, because by meeting in person with limited capacity, they can operate in the dark as they used to, because what is done in the dark is dark indeed. Let me also highlight damage this commission's reconsideration of this proposal is causing. You are creating more work by causing smaller jurisdictions to declare their own emergencies, requiring the county's emergency manager to oversee several smaller declarations. You're causing smaller jurisdictions to cancel virtual meetings, limiting public access because this commission's indecision is creating confusion. And you are also wasting taxpayer dollars by calling additional emergency meetings to push personal agendas. Let reason prevail. Keep the emergency declaration intact. Thank you.
Thank you for joining us.
John Greer.
Hello, commissioners. Thank you for the meeting today and the chance to speak. Following that, I fully understand the reason.
Mr. Greer, can you give us your address, please?
I apologize. 2015 here on Loop in Howell, Michigan. Reason and nothing will ever come over freedom. If we had, in my opinion, come with a prepared plan of what we were going to do in the event that the meetings were going to go back to in-person on April 5th, then a lot of the debate wouldn't have been had last week. I believe we came to the meeting without those plans with the intent that it was going to be continuated and extended on. Otherwise, I believe we would have been fully prepared for it. Nothing supersedes freedom. Again, these discussions and even the restrictions on the meetings are all based off mandates that are unconstitutional. So we got to get back to the roots and the basics of what we're founded on. Any of the limitations, any of those should not continue forward. Science, and there's a lot to back that. There's a lot to back the different variants that are all within 0.03% of each other. There's zero debates going on with everything that's going on. So if we do our own research and not follow the propaganda, I believe that we will see that freedom is being restricted, and every single step we can make towards that will only unify us as a community and then ultimately unify us as a state. And that should be our goal. I appreciate everybody's time. Thank you.
Thank you. Thank you for joining us.
Kate Derozier.
Good evening, and thank you for this time to speak. I was not at the last meeting when this was passed.
Ms. Derozier, could you provide your address, please?
I am so sorry. My name is Kate Derozier. I am at 10484 North Valley Court in Heartland Township. I'm here tonight, actually, and thank you for the reminder, Commissioner Nakagiri. I am here tonight speaking on behalf of the Cromaine District Library. I serve as on the board. I'm a trustee and president this year. And as I started out saying, I had planned on speaking tonight to say thank you for the resolution of the 15th, because we have been meeting virtually since the beginning of the pandemic, or since there were orders in place, and found it to be a real godsend. We serve in Heartland Township. We serve actually 6 townships and 12 precincts at the Cromaine District Library. Our service area is probably more than it was in 2010, but officially 26,400 people. We have a staff of 29 dedicated women and men. 90% of them qualify for vaccinations April 5, the start of April 5. 3 on the library staff are fully vaccinated so far. Without them, we can't function. I want to thank the staff as well publicly because they stepped it up in March and created literally hundreds of online programs. And I believe as a result of the pandemic, we are facing now a situation where virtual programs, virtual activities, group book club groups, meetings are not a thing that are going away. I think that we're here in an age of hybrid meeting for sure. And I think that is a good thing. I think it's great to welcome more people to the table at meetings, and I appreciate you meeting virtually. So I'm a member of a 7-member board. We have several board members with immunocompromised situations, whether it's they themselves or family members. We have board members who cannot get vaccinated until April 5 or later because of the way it was set up. Right now we are sort of in a pattern where we're grateful to have virtual meetings. Livingston County currently has a designation as a very high-risk area. The COVID infection rate has increased by 128% over the past 14 days. In the last 7 days, there have been 90 cases per day on average and in our county, and so far nearly 12,000 have been infected in our county.
Rose, you have 10 seconds.
154 people have died. At this point, because if everyone's vaccinated, even April 5 on the very same day, the earliest they would all be in line to actually meet publicly would be the middle of May. I urge you to extend this not only to May 31, I would take it to June 30. Thank you for your time tonight.
Thank you. Thank you for joining us.
Cindy M. Cindy, are you able to unmute yourself?
Hi, I'm Cindy Dobenmeier from 3140 Sheehan Road, Pinckney, Michigan. I'm also a Hamburg Township trustee. I'm asking the board not to take a revote on this resolution because if you go ahead and the vote changes not to extend the state of emergency to hold virtual meetings, you will leave all the other jurisdictions in the county scrambling to get their own resolution to extend if they choose to do so. The current resolution ends tomorrow. During this past week, the 16 townships, 2 villages, and 2 cities, as well as the school boards and library boards, have thought that the passage of the extension of the state of emergency at the county level covered their jurisdiction. The state of emergency ends, that doesn't leave them very much time to organize a special meeting to vote on their own. Luckily, Hamburg Township had a special meeting scheduled for today on another matter, and we put our own order to a vote on the agenda at the last minute, and we passed it. I know that Commissioner Gross has been in contact with our supervisor, and he knew where we stood. Have all of the other commissioners had a discussion with the townships, cities, and villages under them to see how they weigh in? There may be a time where our meetings may have to go over the maximum amount of people allowed, and now we have the option to go virtual if we think a topic maybe go over that amount. I think that all of your meetings would go over what is currently available, current number of 25. And according to the Opens Meeting Act, once the 26th person tries to come in, you just can't turn them away. You can't send them to another room. You have to shut the meeting down. Are you prepared to do that? Because I think that will happen at every single one of your meetings. Thank you.
Thank you.
I'm sorry, Grant, you are up next.
I am not a county official. I am a constituent. I'm sorry.
We still need you to provide your name and address.
Grant Howell, and then my address is 4285 Sonata Drive in Howell.
Go ahead.
Okay. Ending the virtual meetings for this county's government would be detrimental due to the fact that the COVID cases in this county keep rising. And I would ask you guys not to end the virtual meetings for everyone's safety. Thank you.
Thank you. Thank you for joining us.
Yvonne Black.
Hello, my name is Yvonne Black. My address is 3985 Cedar Lake Road in Marion Township. And I think that the Livingston County Board of Commissioners should end this nonsense of a state of emergency. There is no state of emergency. And the cases that everyone keeps referring to, if you look on the World Health Organization, the PCR testing that they're using is faulty testing. It's not meant to be a diagnosis. It's meant to be an aid for a diagnosis. So we keep getting all these false positives, 30 to 50%, 70% false positives. And then they make this, oh, we have a pandemic because of cases. So realistically, the governor and the defendant or the director, Elizabeth Hertel, cannot prove beyond a reasonable doubt any clear and convincing scientific evidence that the PCR testing that they're using that creates the numbers and the cases are actually valid. And so we're basing all of this shutting down businesses, restricting and violating people's constitutional rights to assemble, my right to privacy, my right to make medical choices, and it's all based on fake numbers. It's false. It's all false numbers. And so you can read, I emailed the copies to the commissioners of the lawsuit that I filed against the governor, and I've asked for a preliminary injunction because their second 6 month is going to be running out in 2 weeks, and they won't be able to write any more emergency orders anyways. So the county commissioners should take that into consideration. Thank you.
Thank you. Thank you for joining us.
Livingston County guest. Brian, I think that might be you.
Yeah, I think that's me. Brian Jonkier, 350 West Caledonia, Howell, Michigan. I'm a Livingston County Drain Commissioner, and some really good points have been brought up. I did send a memo to the county commissioners. Hopefully you've all read that. We're in a little bit different situation, is that most of the notices that we do for meetings involve public hearings for special assessments and practicability of projects. So those are hearings, which is quite can be a different animal than say a simple meeting, and we have plenty of those. And typically there's so few people at those that we can deal with that. But the public hearings are something different. And I think I mentioned in the last 5 years, we've sent out 39,000 notices for public hearings. In this situation, we've actually set up meetings based on and noticed based on what the county commissioners voted on last week. And so we have situations with public hearings that are coming up that if we have, say, 10 or 15 people show up, there is no way, given the restrictions by the state, that we can actually hold that hearing. All people that show up are entitled to listen to the testimony. And so since it would be impossible to seat them in the room, we would have no choice but to cancel that meeting. In the one particular case that's coming up tomorrow night, and I understand may not be impacted, that would cost, it'd be in the thousands of dollars we would be charging the residents, because we would have to rehear, repost, resend first class mail notices to all of the people in the district. So it'd be quite a cost and we would lose our window actually pushing a project off for another year. So I wanted to make everybody aware we work under quite different circumstances, often with very large public hearings. And I kind of wish somebody had talked to us about it. And while a lot of the discussion centers around closing restaurants and the right to assemble, which I don't understand, the real issue here is how can governments effectively do their business under these restrictions. And I think, you know, keeping with the original vote that you had, you know, would be a lot better and would not create nearly as much chaos and conflict if we have to all of a sudden change directions on this. So anyway, I appreciate your consideration, and thanks to Commissioner Zajac for reaching out to me, and I had a good discussion with him on this. But thank you so much for the time.
Thank you, Drain Commissioner Jonker.
Alice Andrews.
Hi, I'm Alice Andrews. I live at 11833 Stony Ridge, Brighton Township, Michigan, where I've lived for 35 years. I'm currently retired, although I was the director of the Heartland Senior Center for many years. So I have a long history of caring about the people in this county. I would strongly urge the county commissioner to keep the state of emergency in place at least for another several months. Keeping our public meetings virtual is not too high a price to pay for the safety of the citizens of this county. With COVID-19 numbers on the rise, whether you believe it or not, it's the truth. And in some of the surrounding counties is not the time to relax our safety measures. I am grateful to be fully vaccinated myself, and I feel safe, but I still care about the safety of my fellow citizens. Our hospitals are beginning to fill up again with COVID patients. I am sure each of you commissioners ran for public office because you were concerned about the citizens of this county and their welfare. Please keep the state of emergency in place. Thank you for your attendance.
Thank you for joining us.
Judy Dobenmeier.
Hi, my name is Judy Dobenmeier, and I live at 4490 Lakeshore Court, Brighton, Michigan, 48116 in Genoa Township. And I feel like I'm in the movie Groundhog Day. I'm here again on the same issue that we spent 4.5 hours on last week. And I think the commission arrived at the proper decision at that time. To reverse it now would leave local governments in the lurch, and you would be proving yourself to be an unreliable partner to other local units of government. And I don't think you want to get that reputation that your word cannot be relied upon. You know, it's a basic function of government to hold a meeting, and you don't seem to be able to grasp the ability to do that in the middle of a pandemic. If you have your own meetings with only 25 people allowed, when you have 9 commissioners, a couple from the clerk's office and the staff, there won't be room for the public. And the law does say the meetings shall be available to the general public. And I'm curious to find out how you're going to manage that. Of course, I'm sure you all know that violations of the Open Meetings Act can cost individual public officials $500 per meeting. And I want you to keep that in mind as you think about what you're trying to do. And also that any actions you take at a meeting can be invalidated if that meeting is found to be in violation of being open to the public. So please think about what you're doing very carefully and keep in mind the safety of the public. That's one of the basic functions of government, and crowding people into your small meeting room, unless you have some other idea up your sleeve that nobody knows about yet. I think you need to be very careful about overturning your decision. Thank you.
Thank you, Ms. Dobenmeier.
Bill Bolan.
Hello.
Hello.
Yes, this is Bill Bolan, 1615 South Old US 23 in Brighton, Michigan. I'm simply a citizen, pastor of a church, and I represent about 1,500 constituency. We would like you to rescind your vote. In the discussions that I just heard, rescission isn't just a possibility, it should be a mandate. We should have access to libraries in person. If all of you commissioners and the various other elected officials who've spoken can go to Kroger grocery store with mask on, socially distance, and access product, we expect the citizens to do the same. Otherwise, and if you're not going to attend meetings, if 100% participation isn't going to happen in-person meetings, as someone had mentioned, why don't those people simply resign and allow another person to be elected to take their position? Because right now, with the sentiment in this county, with multiple citizens, you are going to find when it comes election time that there will be other names that will stand in opposition wanting to take your place, that will act with sanity in a situation like what we're facing and listen to the will of the people. We live in a democracy in which the voice of the people needs to be heard. At the last meeting, there were 3 people who spoke in dissension about the continuation of the emergency order, and the vast amount of people who spoke, the overwhelming majority, do not want that emergency order extended. Please listen to the voice of the people. We don't want to vote you out, but if that is what it takes in order to bring sanity into this county, you will face massive opposition on the next election cycle. That's all I have to say. Thank you very much for your service, and thank you for listening to me.
Thank you.
Apologize. Jessica Hamlin.
Hello, my name is Jessica Hamlin. My address is 2323 Pleasant Ridge, Howell. I'd like to say thank you for bringing this meeting forward for whoever may be reconsidering their vote choice from last week. And thank you to the 4 commissioners who voted against the extension and voted yes to creating a solution and taking action. We as a community gave the 2 weeks to flatten the curve. In fact, we have given over a year now, and we no longer consent to just 3 more weeks or 2 more months, or how some are suggesting several months. The virus is here and it is not going anywhere. The responsible approach to really keep our community safe and healthy is to listen to the doctors, professionals, and experts that have no special interests or getting hush money, that are providing preventative healthcare plans, immunity building, and treatments that are safe and work. Build the community's health as a whole. Look at the numbers. This is all over cases, AKA positive tests. Some have shared personal experience of someone they know affected by COVID. Well, here's one of mine. I have a loved one sitting in a mental health hospital right now, a second time in less than 2 months. This person lost their job, a career of over 23 years, has been in quarantine throughout this entire year, and is living in fear because of the messages being repeated over and over to our society. The state of emergency goes further than just simply extending virtual meetings. It is just as much linked to this overreach of power. Beware of what science you actually listen to. Medical science or political science? The real emergency are the criminals working within our government who place COVID patients with the most vulnerable. And while we are receiving more mandates and restrictions, especially our youth, we are also facing a crisis at the border. Very contradicting, once again, if we are in such a serious pandemic. Some of you do not want to do your job in person. What does that say to all the frontline essential workers who have been working this whole time in the public for services each of you need? If you do not want to do your job in person, I'm certain we can find someone who will. Governing through fear is tyranny. And again, we do not consent. Stand up, Livingston County. Thank you.
Thank you.
Aaron Wilson.
Greetings, commissioners. I'm Aaron Wilson. My address is 710 Shepherd Street of Lansing, Michigan. It is Ingham County, but I'm here on behalf of mine and Livingston counties. I would urge you not to extend this emergency order. Let's face it, the data and the numbers are just not there to justify this. I said this last week, and I'll say it again. Do not extend this because we got a lot of false positive cases, as somebody mentioned before, and they just don't add up if you think about it. I second all of Jessica Hamlin's statements that were just made there. There is no real state of emergency here. If people are worried about catching COVID or any sort of other disease or whatever, they can stay at home. They can conduct virtual meetings or what have you. They can mask, they can socially distance, what have you. With this, the whole solution to this whole thing, we've already hit herd immunity, really. Even the guy that invented this PCR test that supposedly tests for COVID, he was silenced in the fact that he was saying that it's not designed to test for COVID. So that's going to drive the positive cases up. And by keeping the state of emergency in place, you're violating the constitutional very first amendment. Out of 27, the very first one. Think about it, people. It should not be there. And this thing should be lifted. We should be able to assemble. We should have the choice. Options. That's the key word here. We should have them. And with the First Amendment, that gives it to us. Think about that one as you make your decision, hopefully, to get rid of this state of emergency. Thank you, sirs and madams.
Danielle Anjo.
Hi, my name is Danielle Anjo. My address is 2833 South Hacker Road, Brighton Township. I first want to start off by saying I do not appreciate whoever was unmiked and decided to call my pastor Bill a liar on here when he was talking about the numbers of the people that came on the last call and stated that we did not want to extend the state of emergency, and there was only a few people, 2 to 3, that voted in favor of it as residents. So just to put that out there. Nextly, I'd like to say, are you aware that there are members of the public that do not have access or the ability to attend meetings via Zoom? There are people that do not have that capability. Therefore, you are violating the Open Meetings Act, first of all. I don't see anything wrong with a hybrid situation. Those who feel uncomfortable showing up in person, that's okay. They don't have to. No one's forcing them to. They are welcome to join in on Zoom. Those of us who'd like to show up in person, get that in-person experience that we're supposed to have, we should be able to do that. And as far as other people were saying that our Livingston County working at the library and in different places, I heard them come on here and they stated their concern that they just can't rush and just open things. They wouldn't have the time to get all that put in place. Why haven't we for the past few months been thinking about that? Are we already having our mind made up that these meetings were going to continue virtually without even the idea that it might open back up with some sort of plan vaguely in place? So to me, I find that to be a little alarming. The next thing is we are all adults here. No one's going to force you to come out of your house and join these meetings in person. Commissioners, when you signed up for this job, you would have to be aware that there's going to be things that come up that make you feel uncomfortable. It's okay to be in person. You can still socially distance. You can still wear a mask if you choose to. I don't see why there's a problem. I mean, if you can be at events like Genopolis, then at Genopolis Barbecue, then you can be in person as a commissioner in your job in the building you're supposed to be in. If you can go to Kroger and grocery shop, you can be there in person. If you can go wherever you go, you can go to Florida. I know you guys take vacations. You can come in person, just like I want to come in person. We are all adults here and we can make our own choices. And more than half of us are voting for you guys to end this and allow us to come in person. And that should be our right. And just as well as it should be the people that are terrified to come out and talking about health and safety and all this stuff and they're scared, that's all right. They can show up in Zoom.
Your time is up, Miss Anjo.
All right. Thank you.
Thank you for joining us.
Nancy Durant.
Hi, I'm Nancy Durant. I am not speaking on behalf of any health system at this point, but I can say that I am dismayed at some of the comments that have been made regarding.
Can you provide your address too?
I am Nancy Durant. I live at 4616 Spring Mountain Drive in Brighton, Michigan. I am currently a vaccinator for Henry Ford Health System. I have been a contact tracer. I have been a vaccinator for since January. I'm an asthmatic. I have been involved in healthcare for over 40 years. And I take offense at some of the people that do not believe that the virus is real. It's very real. Currently, people do not realize how scary it is. We have closed to visitation Henry Ford. We've also closed to visitation Beaumont. The cases have skyrocketed. Yes, people have gone on vacation to Florida. We are concerned that some of those cases that are rising in Michigan have been due to travel. My concern with opening up meetings is that as the cases are increasing in Michigan, that we are just allowing ourselves to be more at risk for developing COVID. We don't know that for a fact. I can agree that we don't know how fast somebody can be at risk during an open meeting. We don't know that necessarily people need to come to meetings. We can do that over Zoom. But the fact that we have the ability to have open meetings and we have people that may come and are at risk and don't know it, and then end up in a hospital in an ICU bed where I've been an ICU nurse and I am working my darndest every single day. You are slapping every single nurse in the face if you are continuing to open meetings without any disregard for any healthcare professional. So please, please understand, wait until everybody's vaccinated. We're working on 4,000 people at Ford Field. I'm doing 1,000 vaccinations a day. Please, please, by all means, have mercy on us nurses and extend this at least till the end of May. We're almost there. Please. Thank you.
Thank you.
Rick Nieper.
Hello, can you hear me?
We can hear you.
Hi, this is Rick Nieper. I live at 4662 Kenmore Drive in Hamburg Township, and I think most of you know who I am. I'm taking the COVID virus very serious as my mother died from it, but we cannot continue to hide under our beds with our 500 packages of toilet paper. And, hiding from this virus is not going to fix anything. Other states that have been open, yes, people have gotten sick, but herd immunity is achieved by people getting sick and getting over the virus. So in my mother's case, she was a victim of medical malpractice, and that's what killed her. I'm sure that's what killed a lot of people around the country. So that being said, I think I was rather very boisterous last time about the county having real meetings again. And, you know, all this, I guess doing the Zoom is fine for those who are afraid to come and be in person. But like a lot of other people have said, we go shopping, we go to the store, and people are doing their other business. Why aren't they going to meetings and attending in person? There's a lot of people that have the misconception that we're a democracy. Our country is not a democracy. They need a civics lesson. We are a constitutional republic for those who think we're a democracy. Democracy is mob rules, in case anybody doesn't understand that. So we are a constitutional republic, and we are a free people. This governor has managed to take away our freedoms. And in case anybody hasn't figured it out, this is a test run to see how far they can go with taking our freedom and how much we're willing to take. So yeah, I guess if we continue this, we're just going to continue to let the governor be in power, and we're going to give up our rights as citizens of self-governance. For those of you who are afraid to come into a real meeting that we're elected as commissioners, I said it last time at the second call to the public, I think you should resign and give up your position and let an adult come to the table and do the job. So
You have 10 seconds, Mr. Nieper.
okay, and for those of you who voted correctly last time, I thank you for your vote. And I guess that's all I have to say. You have a good day. Thank you.
Thank you.
Cindy?
Hi, my name is Cindy Holland. I live in Howell, Michigan. I want to ask you to please rescind the vote that you took last week and end this false state of emergency. We are talking about a virus that, if treated, is a 99.8% recovery rate, and that includes people 70 years old. And as far as the 6-foot rule goes, like I said the last time, I had to sit here and listen to that. That rule is not even, that's no longer in place. That went down to 3 foot, which equates to about 1 seat space between each people or each person. I'd like to reiterate what Yvonne Black said about the 50 to 70% false positive rate in these tests, that in these cases, that numbers that people keep repeating here. And I think the hybrid options of doing in-person meetings alongside of Zoom meetings for people who are not comfortable coming out in person is the perfect solution for everyone. And for the lady who says that the cases are up because of travel, of course the cases are up because of travel. It couldn't possibly have anything to do with the traffic coming from across the southern border. Now, if we're so concerned that there's so many cases and this virus is so horrible, why are we continuing to have illegal crossings across the border, and those people are coming over here, and those tests are saying that they're 50% of those people are positive tests? So if the people are so afraid that this virus is so out of control, how about we shut down the border? I find it very, very disheartening that you guys would sit here and insist that we keep everybody else, all Americans have to stay shut down, but that we have people crossing the border from other countries so they can travel here freely, but the American citizens can't travel freely. You're ridiculous. I'd like to thank everybody who voted to end the state of emergency and stick by the Constitution and the oath of office that you took to represent the people, and the majority of the people in this county do not want to be restricted any longer. And if the other people who are in opposition to that, why don't you take your arguments over to the governor if you have so much issue with all the restrictions that you're going to have to comply to? Go take that argument to her. And if you guys don't vote the right way, you will be primaried in the next election cycle. Thank you so much and have a very blessed day.
Thank you very much.
Jessica Garcia.
Hi, good evening. I'm Jessica Garcia. I'm a resident in Brighton. And I just want to address the issue of sanity that came up, which is a really ableist term to begin with. I would like to argue on behalf of folks who need these meetings to stay virtual. In fact, I would love to see these made permanently virtual. I think the comment that was made about the lack of internet accessibility is absolutely a valid one. And so when we think about accessibility in diversity, equity, and inclusion, what we think about is how to make sure everyone has full access to participate. So having the option to be there in person is great. Having the option to be virtual is also great. Several folks have mentioned, well, we can go to grocery stores, we're comfortable going to restaurants, we should be comfortable coming to meetings. Here's the thing. We have the option of doing curbside pickup for groceries. We have the option of doing carryout for restaurants. We don't have those options if you go back to only in person. We have in this country, over 60% of the country has a minimum of one chronic health condition, a minimum. Right now, the current vaccine rate at the country, right across the nation, is only at 15.5%. Now, I understand that they're going to waive all eligibility requirements, and so hopefully that number goes up significantly quickly. But in the meantime, I really want to encourage folks in the county commissioner to think about what it would take to go hybrid for everyone. My understanding is that there are some jurisdictions that don't have the budget to run both of those things, to have in-person and virtual at the same time. And so I think it is responsibility of our county to make sure that we can provide the necessary resources for them to do that. And until those are in place, it needs to stay virtual. You can't force folks to come into a space where they are physically in danger of being present, or they have to choose to opt out. I think other folks have also mentioned the other people who couldn't participate. I'm one of them. I'm a single parent. I couldn't join this call until my child's dinner was ready. I couldn't leave to join this meeting in person because I couldn't leave my child at home. So there are lots of different reasons why folks would prefer it to be in person. There are lots of reasons why we would prefer it to be virtual. I think that creative problem solving, forward-thinking folks as yourselves can find a way to satisfy both. But until you can, I think the risk is too high to go in person. And I hope that you will reconsider the reconsideration and keep things where they are until you can appropriately budget for everyone to have that option. Thank you.
Thank you for joining us.
Elizabeth Johnson. Can you unmute yourself?
Yes.
There you go.
Can you hear me?
We can.
Okay, perfect. Thank you.
You're welcome.
Hello, my name is Elizabeth Johnson, and I live at 4625 Spring Mountain Drive in the city of Brighton. I think that I spoke last week as well, and I am against extending the state of emergency. I think an extension of the state of emergency just by sheer name extends fear. And we need to back away from fear right now. It's detrimental to our children. It's detrimental to unfortunately, this has been coming up, and I know there's a lot of stuff going on and things, people are busy and a lot of changes and things, but unfortunately, a lack of preparation is not a reason to extend this state of emergency. I understand that maybe people don't have the resources and things like that. So I think a hybrid is a great way to go. I think that should be offered. I mean, we've learned a lot of great things through this whole situation, and we should use those things going forward. But I think, again, extending the state of emergency is an extension of fear in the county, and we cannot stand behind that. There is no reason why my children, I have 3 in 3 different schools in Brighton, that can go to school for 4 days a week, and they can go to school no problem. But adults that most are going to be vaccinated can not be in-person meetings. It is absolutely ridiculous to think that this is acceptable. And so I just urge you to stop spreading the fear, to let it start with Livingston County. Let us not only be proud of our school system that has stepped forward and charged how everything with our school districts, we should be very proud of that. And let us have our county commissioners and the county of Livingston County step through, stop the fear, put an end to this, please. That's it. Thank you.
Thank you.
Mona Shand.
Good evening, commissioners. My name is Mona Shand. I live at 4852 Oak Tree Court in Brighton. I feel like everyone is getting unnecessarily hung up on one word, emergency. So I wanted to bring up another kind of emergency to put things in context a little bit. Every winter when the snow falls, our local governments declare snow emergencies so that the roads can be plowed. Never once have I heard anyone debate whether that word is too strong, or have I heard of a municipality declaring a snow emergency and then trying to take it back while the snow is still falling. I've never heard anyone talk about their freedom to park where they want being infringed upon because of a snow emergency, or have had lengthy debates over purchasing new equipment that allows for keeping cars in place so that the plows can maneuver around the cars. So I would just urge you, please don't let one word keep you from doing the logical thing that has been requested of you by what this commission often says is your most valuable asset, your staff. Thank you.
Thank you.
Danielle Anjo.
Okay, so the other thing I wanted to say was,
Anjo, did you speak earlier?
I did speak earlier.
I would ask that you wait till the second call to the public, because the rules are everybody in the public gets a chance to speak. If I let you speak, I'm going to have to let everybody else speak twice in this first session. So I would appreciate it if you have something else to say. There is a second opportunity, and you'll have an opportunity to add whatever you want to at that time. I apologize, but that is the rule.
Okay.
Leanne Blazerski.
Yes, hello. My name is Leanne Blazerski, and I live at 209 Lincoln Street in the city of Howell. And I just wanted to add that I would like the Board of Commissioners to rescind their vote and have open in-person meetings. I don't have a lot of information about the particulars about the Open Meeting Act, but I do know as a registered nurse for 30 years, and I'm also I'm currently contracted to conduct research in the state of Michigan on the effects that different parts of this pandemic have had on various communities. And by far, what I'm finding in my research is that the impact on social concerns outweighs any of the physical impact that the COVID-19 has had on people. And so I just wanted to counter some of what that other registered nurse mentioned. And so I do support the rescission of this, of your vote. Thank you. Bye-bye.
Thank you.
Livingston 2A.
Hello, this is Rob Rodriguez Palazzari, 8209 Robbins Drive. I would like to thank the commissioners that voted against extending the emergency the last time around. I think it's the practical thing to do. I do agree with many of the comments from the other side. I do believe that not only is it practicable to continue a hybrid meeting, I think it's completely possible and it can be done very cheaply. I strongly support that the commissioners consider doing that. Regardless of what is going on outside of Livingston County, I think it is the commissioners of Livingston County's duty to be the pulse and be the temperature of Livingston County, not of Lansing, Michigan. And so as the pulse of Livingston County, I would love for you to set the tone for Livingston County that we will no longer live through fear. We will put logic over fear, and we will do some in-person meetings. And at the same time, we'll continue the hybrid style meetings so that those that might be afraid or may have some concerns, very legitimate concerns, that they still have the ability to do something. And you know, the online meetings are pretty neat because we have like 83 people online right now. But several people, while I was listening to them speak, Elizabeth Johnson, for instance, she got missed because of a bandwidth issue. Several other people had bandwidth issues and they got clipped. Miss Andrews also, you know, some of what she was saying, I didn't hear everything there. So there is some that we lose through the technology of online meetings, and that is something that wouldn't exist in person. So thank you, everyone that has decided to reconsider this. And I would ask that you stop the emergency from here on in. Thank you.
Thank you.
Megan.
Hi, this is Megan Weller. I'm at 1650 Newgate Lane in Howell, Michigan. I wasn't actually planning on speaking, but something that somebody said earlier about most of the county being in support of reversing this resolution, I think is not a true statement. And so I was on the call last week and I didn't say anything, but I do support the emergency declaration and continuing virtual meetings. So I felt like I needed to come on here and say that. And I know there were others on the call that felt the same way. I think a lot of the people that we've heard from tonight, they fall into kind of two categories. Either they're impacted by this and that they would be forced to come into an in-person meeting. We've heard from board members, library trustees, and then we've heard from public members who don't have to come to a meeting. They have the choice on whether or not to come. And I think that you really need to put weight into the needs and wants of the people who would be directly impacted by this change. Lastly, you know, you're responsible for our dollars. And, you know, you've heard from some people who talked about a project that would be put behind if this resolution was rescinded. You know, I think that if that's something that you're seriously going to consider, you need to think about the financial impact. And also, you know, the fact that you are doing this, you know, a week after you originally made the emergency declaration puts people in a really rough place. So if you really do want to change this, then maybe extend it through the end of May, give people time to figure out what they're going to do. But switching it a week after you voted to have the emergency declaration just does not feel right. So that's all I had to say. Thank you.
Thank you.
Lynn.
I can't hear him.
Lynn, we're not able to hear you.
There we go. Better?
Yes.
Excellent. Thank you. Lynn Vogel, 4 and 5 Northeast Street, Brighton, Michigan. I don't have any cool quips or videos this time around, so sorry about that. I do want to say it's really interesting to see what I can only imagine is a certain level of unrecognized cognitive dissonance and demanding more vaccines for our incredibly vulnerable population, and then deciding that we will not allow said population for the time being to attend the meetings that they would like to in the safest way possible. I also want to point out that it's not fear to sit at home as much as possible and get curbside pickup. You only fear what you don't understand. If you're afraid of this thing, then I highly recommend that you learn about it, and that way you can, fix that fear. But I stay home because I know how communicable this disease is. I stay home because I have an elderly father who, thank God, has gotten his first dose, but who is still susceptible to it. I have kids who are at virtual school because they are as safe as they can be by doing that. So it's not fear that drives those decisions. It's knowing how communicable the disease are and knowing that it has incredibly long lasting effects. I'm just not going to expose myself or my family to that. And that's really all it is. I'm not afraid of it, but I know what it can do. As far as I'm aware, this emergency declaration allows these meetings to continue virtually. I'm not sure that it requires them to be virtual, but I agree with Ms. Garcia that let's do that. Let's keep that going for a little while till we can get the hybrid stuff going. And that gives everybody the options that they would like to do for attending these meetings. I think that would be, if you're wanting to help people, help the most people that you can. That's all I got.
Thank you very much.
Ann Gebauer.
Yes, my name is Ann Gebauer, and I live in Iosco Township. I'd like to thank you for letting me address the meeting. I come from industry, and we use virtual meetings all the time. This should be a very easy transition to go back to in-person as well as virtual. You carry your laptop into your meeting, and you can pop your screen open, and you dial in whether you're in the room or not. And so everybody is dialed into the meeting, and they can to see who all is responding, so the public can dial into the meeting, but you have your elected officials in the room so that the public can also come and access them. So the only thing that you have to be careful for is turning the video off, because depending on how your internet is set up, your video may monopolize. So the attenders turn the video off, but the people that are remote can have their video on. It's a very easy setup. So I am in favor of ending the emergency status and having virtual or in-person meetings with the virtual meeting dial-in is how you do it. Thank you.
Thank you.
Is there anyone else who would like to address the public? I'm sorry, that would like to address the commission?
I see Joe and Kathy waving their hand.
Okay. Joe and Kathy, are you able to unmute? There you go.
Yes, there you go. Okay, thank you. I am sure all the commissioners checked with the townships they represent, and I would like to hear what.
Full name and address, please.
Oh, I'm so sorry. Kathleen Carney, 6294 Kenyon Drive, Brighton. I'm sure all the commissioners checked with the townships they represent. I would like to hear what they said to, what the townships conveyed to you about doing this. I support the emergency extension. And that's, I think it's very important for the townships and for all the other meetings that are held within the township. Thank you.
Thank you.
Gianni Kazan.
Hi, I just want to thank, I'm Dr. Gianni Kazan. Thank you for allowing me to speak again. I just want to dispel a couple of things. First of all, I learned something new at the last meeting, that local communities can, and they have voted to continue their in-person meetings safely. For example, Heartland Township, they're showing up in person, they're doing their meetings. So when you have such localized control, the umbrella of the county is going to be more of a lead as far as I'm concerned. Not really a mandate per se. They have control locally, but extending a declaration of emergency, I really believe that it's extending fear. You might think it's just about a meeting, but for us as just normal people going about our normal business, it's really, it means a lot more. I would love to see Livingston County be the leader in our state to make decisions based on actual medical science and not fear. And the reason I say that is because I am a physician and I have to make decisions based on medical facts and not emotions. And I very much appreciate the nurse that was speaking. I think her name's Nancy, and everything that she's doing. But in the heat of the moment, as an obstetrician, when the hell breaks loose in labor and delivery, I cannot make decisions based on emotions. We have to look at facts. And I don't know if people actually know facts. First of all, natural immunity is the best way for your immune system to build up immunity. It's not vaccines. So let's not be pushing vaccines when natural immunity is the best. We need to boost our natural immunity. Secondly, there is a treatment for coronavirus. There is a treatment, and it's multiple treatments that, multiple things that you have to prescribe. But we have actual data from earlier on last year that shows that if you treat early a coronavirus infection, you reduce the risk of having to be admitted by 85%. The problem is that we as physicians were not allowed to prescribe the treatments. We were banned. So that itself puts in question what exactly is going on in this state. Next, a case is not the way to count it. A case in the medical world, when we practice medicine, it's somebody who's sick. You come to me with sore throat and fever, I swab your throat and I tell you, you have strep throat. You're a case. My daughter was a chronic carrier of strep for years without symptoms. She had positive tests, but she was not a case of strep throat. So cycled way too many times and it's false positive too many times, but we're calling a positive test as a disease case. And we're basing our policy for health for the entire county or the state based on a positive test result. It is completely illogical. So thank you so much for allowing me.
Is there anyone else from the public who would like to address the commissioners? Dennis Palmer.
Hi, my name is Dennis Palmer. I live at 10382 Grand River in Brighton Township. There's one thing that I just don't understand. How can people not believe that COVID-19 is not real? Look, folks, there's over 500,000 people that have died. I'm a veteran. I've seen death before. This COVID-19 doesn't scare me. It's just the fact of life for right now. I know in my position right now, I tried through Livingston County Health Department for 11 weeks to get vaccinated as a senior. And 2 weeks ago, I finally got my first shot because I decided to go outside Livingston County because they couldn't give me what I needed, and that was my first shot. So I went to Redford Township and I got a shot in 15 minutes. I'm waiting for my second round. All I can say is this is real, folks. It's not a game that you can play with falsehoods, change the narrative that it's not happening. It's a fact of life. Over 500,000 people in the United States have died. Think about all the wars put together. Folks, we've got a real problem, especially in Livingston County now with the variants coming on board. I just want to get my second shot. I don't want to be put on a ventilator. I've read the facts. I know the people that are in charge have got brains. They don't believe in this falsehood of that there's no COVID-19 going around. It's a fact of life, folks. So I would encourage the Livingston County board members to continue the course of this virtual meetings. You only put people in possibility of death taking place if they attend it in person right now. These numbers are skyrocketing. They're not going to stop. Believe it, folks, it's out there. So I would encourage you folks on the board to get this thing moved up, maybe to May, maybe to June. It doesn't matter to me. But in order to have the public attend in person is a foolish move right now. So please, common sense, think about the experts. Those are the ones that make the decisions on what's right and wrong. And right now we're headed in the wrong direction. Thank you very much for your time.
Thank you. Thank you for joining us.
Masks don't work.
Oh, you forgot my last name. Says it on the box. My name is Stephanie Krieg. I live at 7732 Partridge Hill Drive, Brighton, Michigan, 48116. Jay Gross is who I voted for. I spoke last week about how appalled I was. I emailed him, and just on record, I have not heard back. I've emailed him several times, and I just don't hear back. I know he's sitting at home because he sounds very scared, which is totally fine. Everyone can stay home. You can still stay home. We don't need a 3-minute talk about how you're staying home. Just stay home. It's really not that complicated. But I want to go out and live my life. I have the Constitution, this really old document. I know no one reads it anymore and no one cares about it. And we just want to set it on fire because there's one little virus running around. But I have the Constitution on my side. And it says that I have life, liberty, and the pursuit of happiness. And if that means I want to go to a meeting and albeit risk this 99.98% chance that I'm going to survive, then I should be allowed to go to the meeting. Also, it's very concerning as a homeschooling mom that the librarians still want to stay closed. As someone who lost their job during this time, I would happily take your job. If you are scared, again, you can stay home. I'll come take your job. Like Pastor Bill said, please resign. There are lots of people that aren't afraid, that want to go about living their livelihoods, earning their money, and doing things. So thank you guys to the 4 people that stood up for the Constitution. Thank you guys for understanding that it's not just one little word. It's an emergency. It is not just one little word. You can ban our travel. We stayed home for 2 weeks. We stayed home for a year. And now you're asking to ban our travel. That is a big deal. Even Sheriff Murphy went on and he said he will not enforce these unconstitutional mandates. You guys need to take an oath of office seriously and know that, like Cindy Holland that said, that we are going to come after you if you do not stand up for our rights. I mean, it is getting ridiculous. And for everybody that wants to stay home, again, for the 100th time, we don't need 3 minutes. You can stay home. Thank you. That's all I have.
Thank you.
Is there anyone else in the public who has not spoken who would like to speak?
I see Jane Suarez forward waving her hand.
Let me find her. There you go.
And then after her, I see Janine Iyer. So
thank you. Jane, you should be ready to go.
Okay, can you hear me?
Yes.
Jane Suarez forward from Brighton Township, Livingston County. I was just listening to Dennis Palmer, and my husband and I had to do the same thing. I went out to Oakland County to get my COVID shot. He went to Wayne County to get his. we've had our first COVID shot, and then we still have to go back for our second one. And I think all this infighting that we're seeing here on this call is caused by the governor and the people that surround her in Lansing. So maybe we should take a look at that. That's where it's coming from, because of the rollout she did with the SVI, that index. She underserved our county. That's the problem. And I wasn't even on this call the last time. I just sat here and I listened to everybody's viewpoint. And there is, we have another family member in my home who hasn't even gotten a shot yet. We're still waiting for that. That's, I guess, coming down the road a few weeks away. So we're underserved here again. And I talked to the Livingston County Health Department. I've talked to, all these, going on the pharmacy websites, it's a waste of time. I'm signed up with the hospitals and everything. Waiting for some kind of email from them. You get nothing. So we're all looking, we're fighting with each other. And I don't know where you stand on this. Maybe you could have get rid of the state of emergency. I'm getting tired of being told what to do by Lansing. I've been told what to do by Lansing for a whole year now. And maybe we could get rid of the state of emergency and do the hybrid thing where people could call in if they're worried about the COVID. And I don't even know, help satisfy both sides of this issue. But I think we're fighting with each other, and the problem is Lansing. That's the problem, being dominated by them up there. So that's all I would suggest. But having to leave and then I talked to people who are 82 years old who flat out said they didn't want to go down to Ford Field. They want to drive down to Ford Field. They hadn't gotten a vaccine. This was a couple of weeks ago. It was just it was sad. So I don't know, I guess there's two points of view, but I'm getting tired of being dominated, told what to do, and, so many people in a room and all this stuff. And that's all I just wanted to say. I don't know where I fall down on the whole thing, because I know people feel different ways about stuff, but I'm still waiting to get my second shot in a different county. That shouldn't be like that. And I'm not in agreement with the SVI index thing. I wonder what's going on with that. I'd like
15 seconds before.
All done?
Yeah.
All right. Well, thank you. Thank you, Chairman.
Thank you. I'm glad to hear you got at least one of your shots.
Thank you.
Janine?
Hi, my name is Janine Ayer. I'm at 2396 Brighton Road in Howell, Genoa Township. I'm in favor of ending the declaration of the state of emergency in our county. I wanted to address the man who talked about the COVID deaths. The CDC redefined COVID deaths as deaths were counted if a person had died with COVID, not necessarily of COVID. So a lot of the data is inflated, as well as Dr. Kazin mentioned about inflation of case numbers. I guess what I want to say is I understand that many of you in government want to continue to meet virtually. It's convenient. I understand that, and you haven't planned for it. I understand that, but you have to realize that the declaration of a state of emergency in our county affects just more than just you. It has an adverse effect on 90% plus of the people in our county. And I just wanted to read a few lines from the Great Barrington Declaration, which was written by a number of doctors, prominent doctors in the US and all over the world. And it says, as infectious disease epidemiologists and public health scientists, we have grave concerns about the damaging physical and mental health impacts of the prevailing COVID-19 policies and recommend an approach that we call well-focused protection. Basically, what they recommend is that the less vulnerable are allowed to live their life as normal, and you protect the people that are more vulnerable. And the reason why they recommend that is because there are so many unintended consequences to having these very highly mandated policies. And I believe that, you know, the government officials at the state and federal level are safely meeting. And I believe, and I would desire that our local government would meet, because I would like to participate in-person meetings. And like I said, you know, yeah, it affects kids, it affects everyone in society. We are social beings, and we just need to end this declaration of the state of emergency. Thank you for your attention.
Thank you.
Mm-hmm.
Farrell?
Hi, my name is Stacy Farrell. I live in Osceola Township. I just wanted to take a moment to take a more pragmatic approach to what this is. It's not about the governor or the border or whether or not someone has gotten their shot. I mean, when you make this decision tonight, what I want you to think about is whether or not this is an effective way to do business at this point in time. And the answer is simply yes. It's working, it's effective, and it's just the right thing to do. Thank you.
Thank you.
Is there anyone else from the public who wishes to speak who has not already spoken? Commissioner Nakagiri, I did not see any other hands raised.
Yeah, I don't see any either. So thank you, Ms. Kadnick, for taking care of the call to the public. I'm going to go ahead and close the call to the public, reminding everybody that there's a second call to the public. Next up on the agenda is item number 6, tabled items from previous meeting. There are no tabled items from previous meeting. So that brings us to approval of the agenda tonight. I'm looking for a motion to approve the agenda.
So moved, Plank.
Support Zajac.
Motion by Plank, support by Zajac. Discussion? Hearing none, roll call, please.
Commissioner Plank. Yes. Commissioner Lawrence.
Yes.
Commissioner Reeder. Commissioner Reeder, thank you. Commissioner Nakagiri.
Yes.
Commissioner Helserman.
Yes.
Commissioner Zajac.
Yes.
Commissioner Dreck.
Yes.
Commissioner Griffith.
Yes.
And Commissioner Gross. Commissioner Gross, you are muted.
Sorry, yes.
Thank you. Motion carries.
Thank you. Next up is item number 8, reconsideration of resolution 2021-03-040. It was a resolution authorizing Livingston County to declare a local state of emergency. Just as a point of order, this resolution is to reconsider the decision that was made previously. If the reconsideration passes, there will be another vote to whether or not we want to have a local state of emergency. So with that being said, is there a motion to reconsider?
So moved, Plank.
Support Zajac.
Motion by Plank, support by Zajac. Any discussion?
Mr. Chair?
Commissioner Plank, go ahead.
Okay, first of all, I just want to say thank you for scheduling the special meeting at my request. First, I definitely want to apologize to the Board of Commissioners and our County Administrator, Therese Cremonte and Chris Toby, for my indecision. I want to say that back on Monday, my vote was actually no. But towards the end of the meeting, I started to reconsider based off of whether or not we would be able to hold effective meetings from some of the discussions that we had. So knowing that we could come back and change this, I went ahead and voted yes to the emergency declaration. And then the very next day, I had an opportunity to have a great conversation with Chris Toby, our IT director, and with Nathan Bird, our county administrator, to get questions answered that I had that would help me to come to the conclusion whether that no vote or the yes vote was the right vote, or should I have voted no. After speaking with them and understanding the positions they were in, to be able to help us to have both in-person and virtual meeting, because I believe that some people are under the impression that if we vote no, that everybody has to come into chambers during our meetings, but that isn't the case. People who choose to join our meetings virtually still have that option. I don't know if it seemed like from some of the discussions from the call to public that people were confused by that piece. But knowing that there is that option that they can still join us in the meeting, but virtually, so they can stay safe at home, taking care of their business. If it's convenient for them, I think that the Zoom meetings are great for people who need to join us in that fashion. So after my conversation on Tuesday morning, I felt that there were going to be some hiccups. It wasn't going to be perfect out of the gate, but it was still manageable. So, with that, I requested the special meeting so that we could come back and rescind the vote and vote again. So I feel very satisfied now that technically we can do this. Might not be perfect, so hopefully people understand that, but we can do this. And so I'm looking forward to coming back into, or coming to chambers and serving the people of Livingston County. That is all I have. Thank you, Mr. Chair.
Thank you, Commissioner Plank. Are there other commissioners that would like to speak to this motion to reconsider?
Mr. Chairman.
Commissioner Gross.
Thank you, sir. As Commissioner Plank has mentioned, I too have had a lot of thoughts and some conversations since we passed the resolution last Monday evening. And I still believe that we need to continue with the resolution that was passed for the following reasons. Number one is by rescinding the resolution to continue with virtual meetings, that is an action that covers all other jurisdictions within this county. 16 townships, 2 villages, 2 cities, a number of library boards, other committees, boards, both county and otherwise. And we're doing this 2 days before the state law expires. And some of the jurisdictions have been wanting us to take action. And their preference, and at least in my experience, talking to the officials in Hamburg Township, was they wanted us to continue virtual meetings. And it wasn't until just today that Hamburg Township changed that position because of a timing issue. And so they, in a meeting this afternoon, a special meeting that they called, they voted their own declaration state of emergency so that they could continue operating virtually. And I'm aware of, as I mentioned, library boards, et cetera. And we have put a tremendous burden on some of these jurisdictions. They have very little time to react. They have to call special meetings, what have you. I think we as an organization missed the boat by not bringing this up or discussing it sooner to give these people some time, and ourselves. We have a general government meeting scheduled for a week from today on Monday, April 5th. And if we do away with virtual, that means we need a quorum of commissioners in chambers. We're going to need support staff, and we're going to need to be able to allow the public to come in, which is their right and which we want. But what are we going to do if 40 people show up? There isn't room in board chambers. There would be perhaps for 10 or 12 people. We don't have another room that'll hold 25. Are we going to be telling people, sorry, you can't attend, go home or go to your car and attend via Zoom? And what's the plan? Who's going to be at the door counting numbers and checking? And are we going to have nurses there with thermometers checking to see if somebody's got the virus or a symptom? There's a lot of pitfalls with going to in-person or even hybrid meetings, and we don't have a plan. Those of you who wish to, Mr. Chairman, those who wish to go in person, what is their plan? What are the details? I personally have very much heartburn with asking, these meetings are our meetings. They're not the administrators. They're not the director of IT. They're not the director of the health department. They're not the CFO. They are commissioner meetings. So where is our plan? Who has got a plan that says how we're going to operate come April 5th and subsequent days? There is none. And so this timing issue is very big for me. Secondly, we have seen a spike in cases and deaths in the county over the last couple of weeks, and that's undeniable. And I am very concerned about the overall welfare, safety, health and safety of not just commissioners and our support staff, but the public as well. And there's a lot of misinformation out there. I've gotten innumerable emails. I haven't responded to all of them as yet, but somebody pointed out to me that there's been 22 deaths in the population from age 0 to 69, and they dropped it at that. They completely overlooked the fact that there's well over 100 people that are over age 69 that have passed away. My concern is about them, the senior citizens that are not able to get a vaccine, that have to go elsewhere. And so my overriding concern is exposure to risk of the public coming in to attend our meetings. That's all I have to say.
Thank you, Commissioner Gross. Any other commissioners would like to speak to the reconsideration?
Yes, Mr. Chair.
Commissioner Lawrence.
Thank you. I have some things I want to say, but I first have a question for our legal counsel. Matt, I know you're there. You're probably on my page 2 or 3 here. But
Yes,
here's
I'm
my,
here.
there you are. All right, here's my question. I've read this resolution backwards and forwards. My question is, do we need to declare a local state of emergency to do a hybrid meeting? In other words, all the commissioners or any staff are physically present, but to allow the public to attend hybrid, do we need a declaration for that?
So under that hypothetical, no. The commissioners, it's your meeting, have to be there physically present to count towards a quorum, unless
Correct.
you meet one of the exceptions under the act, which isn't just a local state of emergency. It's also military duty and medical. But in your scenario, you do not need a state of emergency to authorize the public to participate virtually.
All right. So the 26th person could be online.
They could be. You can ask them. You can suggest it. The problem becomes if you need to require it.
All right. Thank you. That was my question. And, you know, this has been asked tonight, and I went back and I wrote this up. I said, you know, we started talking about this issue in December. Our county administrator on every occasion would bring this subject up. Our local municipalities had been in contact with their county administrator as to what the county was going to do after March 31st. That's just been ongoing. This resolution was then placed on the Public Safety Committee on March 15th. And a presentation that day was made by our emergency manager, and some discussion ensued, of course, but that was approved then at a 4-0 vote, which brought us to the full board meeting that we had March 22nd, which is 8 days before the expiration. So last Monday, after several hours of discussion, it was approved on a 5-4 vote. And so now we're here tonight with the Special Board of Commissioners meeting to reconsider our vote of March 22nd. We have 20 plus partner municipalities that are scrambling right now to pass their own declaration if they feel it's right for their jurisdiction. Some didn't wait for us, and some are not interested in passing anything. We also heard from an elected official who conducts many public hearings with large numbers of people. We also heard, who did not speak tonight, but from a department director who holds public safety meetings. I will say that I have to quit looking at Facebook because I have been dragged through the mud. And I want to say that I take my oath of office very seriously. And I believe that I have conducted myself in a professional manner. I am ready, I'm willing, and I'm able to go back to in-person meetings. This is not, in my opinion, a vote to extend the governor's state of emergency, nor is this a lockdown. This is just a declaration for the county to conduct its business, and any other municipality that wants to fall under the umbrella. And I'm willing to rescind my vote. But to take into consideration what we have done to our partner municipalities at the 11th hour, and what we are doing to, to some departments that have public hearings. So I wouldn't mind taking this local state of emergency and not extending it to May 31st, but extending it to April 16th, which gives time for all public notices, gives time for our partner municipalities to complete what they want to complete. And if we don't need, and I'm fine with hybrid meeting with commissioners or any committee that has to meet, they meet in person, and we allow the public to attend hybrid. That's all I have right now, Mr. Chair. Thank you.
Thank you, Commissioner Lawrence. Other commissioners wishing to speak to the motion to reconsider?
Mr. Chair, well, go ahead, Commissioner Greer can go first.
Go ahead, Mitch. I'll let you go first. It's fine.
Commissioner Zajac, go ahead.
Thank you. Mr. Chair, appreciate this. And I appreciate all the commissioners taking this issue seriously. And I also appreciate the public who's come on and shared from a variety of perspectives, their opinions. I appreciate both sides of this issue, and I unfortunately don't agree with many of the sentiments of some about why this statement of the state of emergency should exist. But likewise, I don't necessarily agree with all the sentiments of those who believe that the state of emergency should not exist, because I do believe there are some issues that are getting twisted around, and the idea of and the connection to the governor's state of emergency. I agree with Commissioner Lawrence is not there. And I do want to say, just on a personal note, Commissioner Lawrence is someone I consider a very dear friend. And I share her sentiment about how professionally she's done in this, as have all other commissioners. And I also would like to just say that to the extent that personal attacks get made and attacks on personal activities outside of the commission role are completed, I certainly don't condone that, and I would ask people who support my position on things to consider that input. But there is an important thing that we have to consider with regard to this statement of emergency, and why it's important to, in fact, reconsider our vote is because we did not meet the necessary condition precedent for what it is we're trying to do. And what I mean by that is a lot of the comments from the public, a lot of comments from elected officials, whether they're commissioners or elected officials at large, have focused around the question that I see as the important one in reverse. And they've said, we need to meet virtually in order to accommodate the governor's order, in order to accommodate restrictions from Michigan Department of Health and Human Services, in order to facilitate large meetings. Therefore, we should issue a state of emergency. But the law, the Open Meetings Act, clearly says if there is a state of emergency, then you may address it in a variety of ways, one of them being this electronic meeting fashion. And I appreciate the clarification from Mr. Nordford, and I agree with it in that the law says that the commission would need to meet in person, but there's nothing that restricts us from allowing the public to participate via virtual means. And I agree with some of the comments in the public that said, why don't we make this access available into the future? I agree. I would love a day where there's 9 commissioners, we walk in the room and the meeting turns on and we can have presentations from outside of the commission. We can have public attend outside the commission. And I think we're in a position now, based on the feedback from Commissioner Plank and through Administrator Byrd and through Director Toby, to actually facilitate that exact kind of meeting within our commission. I also agree with Commissioner Plank that once hopefully we rescind this order and we have in-person meetings, of course it will be clunky and there will be feedback, and we may need to take a break to make sure we don't get echoes and those kinds of things. But again, the rule that we're addressing, this state of emergency under the Open Meetings Act, is not one that's asking for us to be able to perform this seamlessly. Unfortunately, we did not take this up until March 15th, despite, as Commissioner Lawrence said, feedback from Administrator Byrd, from the municipalities about questions on how we will proceed at the sunset period of this exception to the OMA. But I do find it interesting to learn, I didn't know this until discussion tonight, that Heartland Township has decided not to issue a local state of emergency. So one of the key principles of governing that I believe in is local government and local control. And if that municipality has decided, just like when I spoke with Marion Township, when I spoke with Putnam Township, and even when I spoke with Hamburg Township, my discussion with the local officials a bit different than one of my colleagues. They wanted to make their own decision. They would, in the case of Hamburg Township, we're not going to object, obviously, seeing that they've issued their own local state of emergency. But in the case of Marion Township, in the case of Putnam Township, they were quite happy to continue their in-person meetings. And I, in fact, spoke with the president of Pinckney Village, and she indicated to me that because of a inability of even the board themselves to meet with the 6-foot distancing requirements, they would not be able to conduct meetings in person, and therefore they were issuing a state of emergency. They addressed a health issue, a local spacing issue of their board, and they made a determination. And I leave it to the local municipalities, of course, to address their local needs differently than us. There's been a lot of comments that I was planning to save for discussion on the motion itself, but I think it's apropos to the reconsideration. There's been comments about the 25-person limit. That's not, it's not a fact. Though in general participation in gatherings, it's limited to 25 people. The frequently asked questions addressing the Open Meetings Act interpretation and the impact of the health declarations from the state on those interpretations of the OMA clearly say that as long as you can prescribe to the distancing requirements, then the 25-person limit is not in effect for public participation. How the meetings will operate, I have an idea how I would like my meeting to operate on Monday. And based on the outcome of this discussion today, I will share that publicly if I need to. If it's different than what we decide here as a full board. I agree that we need to address opportunities for broadband so that these long-term virtual participation by public opportunities exist. All of those things said, the law says, is there a state of emergency? We did not properly consider any sort of facts addressing a state of emergency. We only looked at the ability of people to meet together within what the rules the governor has stated they are, or the Department of Health and Human Services. We did not consider health department input. We did not consider the death rate within the county, which I learned over the weekend is a total of 3 over the month of March, which is down significantly from February and January. So my question would become, and when we discuss hopefully the resolution here in a few moments, will be, what is the emergency? We did not discuss the emergency other than to broadly say COVID-19 is a thing. And I agree, many people tragically have died from COVID-19. I'm not questioning the existence of COVID-19 to cause the 500,000 plus deaths around the country and the over millions around the world. The question becomes, in Livingston County, is there a state of emergency, and what information have we reviewed in order to declare that? And the answer is none. And the last thing I'll say, because I'm sure I'm close to my 5-minute mark, is that the implications of declaring a state of emergency locally are not just allowing us to meet virtually. There is a emergency plan. It's 154 pages. One of those sets of pages include the powers of certain individuals within the county, one of them being our chief executive official, which is Mr. Nakagiri, Chairman Nakagiri, as the chair of the board. And the other would be our emergency manager. And they allow for certain decisions to be made. Though I trust fully both of them in this case, we're setting a precedent that cannot be undone, and it will create issues into the future. Again, what is the emergency? We must reconsider on those grounds. Thank you, Mr. Chair.
Thank you, Commissioner. Commissioner Griffith, I think you were next. If you'd like to address the issue.
Well, let me just be brief. I think we are all suffering from COVID fatigue. I know I certainly am. I think I have a real issue with the mechanics of, we voted last week. The vote was a close vote. I certainly appreciate Commissioner Plank that you had questions after the meeting and you went to get those answered. And I know when I talked to you too, I had mentioned for all of the years that I've been on the commission, I have never seen that we re-voted on something because somebody thought things through and thought, yeah, maybe I shouldn't have voted the way I did. There's plenty of times I'm sure that all of us, whether it's a commissioner meeting or any other type of meeting where a vote is required, has said, you know, maybe I shouldn't have done that. There is an avenue that I have seen that commissioners have used in the past, and that would be one on record that says, you know, I want to make it clear on the record that based on the information I had, I voted one way, but I am now going, if the vote were today, I'm going to vote another way. We have known since December that perhaps that the state would not extend this Senate bill, and they extended it a couple of times. So it's not that we weren't prepared. We didn't know without the guidance of the state in terms of what they were going to do, because they did extend it several times. So we were not sure. I think the difficulty comes in, and where I feel really bad, is that last week we gave those governmental entities under the umbrella of our county direction, and they had to make plans. And now here we are a week later saying, well, you know, you need to make different plans or change your plans. You know, our emergency manager, Therese Cremonte, told us when we voted at subcommittee, she made it very clear that this is an avenue, an administrative avenue, so that we can carry on our business. And we can do that virtually, or we can do that in person. So this was to assist those government entities under one umbrella, that she can file one emergency management declaration that gives this latitude to those that we serve. Now, each of those, yes, each township or village or city can now appoint someone that's their emergency manager, and she is willing to do all of the recording at the state level and do, because she's accommodating all of these people. But I just don't think it needed to be. I do think that the numbers are real. The COVID is increasing in alarming numbers. That's coming from our health department. I believe that the reason I voted the way I did is because I think there will be more vaccinations for those that need to be vaccinated in our county. This resolution gives us to May 31st, unless we want to lift it earlier. It's not saying that this is 60 days, but again, I know we all 9 of us have opinions on how they interpret this, but I have concerns about those, like mental health, that we got an email from that said they'd really like to continue with virtual meetings because they're concerned at that agency. The drain commissioner, you know, his meetings are a lot larger than our meetings. So there's other people that have concerns here, but I have a really, really big concern saying that we have voted one way, and now we are going to possibly rescind that and vote a different way. Does this set a precedence here that we will do this at other meetings? And what does that say to some of our local governments who say, well, we might have voted this way, but you know, we could change our mind, and then that will throw you into the tizzy, and you have the special meetings and try to get your agenda through. I really think I think there's 2 thoughts here, 2 things that we need to think about in terms of our actions. And that's all I need to say. Thank you.
Thank you, Commissioner Griffith. Other commissioners?
Chairman, I have a comment.
Commissioner Reeder.
There are always 2 sides to every issue. And I know that when I was on the bench, I listened daily to each side. Based on the information that was presented, I made a decision. I was never not and what I thought if I was presented with information that went into my thought process that changed the meter from what I had said. Having said that, I agree with Commissioner Griffith that this is awful for all of the people that are relying on what we did last week, and that it also sets a precedent that if we make a vote, we can just change it for whatever reason. But these are uncharted times, and we need to do what is best for our employees, and we need to do what's best for our citizens. And when you put the two factors together, the whole thing comes down to, I have no problem being in the chamber conducting business. I do have a problem with the public having to come in person if they don't want to. So if we can make arrangements to have Zoom meetings for the public, I have no problem being in the chambers. So on that ground, I would reverse my vote as long as we can come up with a resolution to allow the hybrid. Thank you.
Thank you, Commissioner Reeder. I think the only commissioner who hasn't, oh, no, we have two. Commissioner Helsmer, do you have, would you want to address this issue now? If not, I'm going to take my 5 minutes.
I have a question for our attorney.
Yes, you muted yourself.
Can you hear me now?
Yes.
Yes.
Okay. I have a question for Matt. In the Open Meetings Act, it does allow for an emergency to have, it does allow in the law for an emergency. Or is that a separate thing from the law?
So the Open Meetings Act as amended permits a board to meet electronically under a declared state of emergency or state of disaster. So that's in the amendment. It's 15.263A.
Okay, so that was something that has been added since this pandemic, and
yes.
And so any local government can do it. My question is, because at the last meeting I had talked about the possibility of declaring a state of emergency and saying that as we were changing the Open Meetings Act, we could change another act of department by an emergency act. Has that ever been done, that a local body has, because of a local emergency that they declared, have they set aside, at least for a temporary time, and another act of the legislature or duly placed order of a department?
I can't answer that, not that I'm aware of, but I would caution against that because it would likely be beyond the scope of the county board's authority to contravene a state law.
Okay, so that's okay. So that kind of answers my question. I think that there's not a state of emergency here. I agree with Commissioner Zajac on that. I do have sympathy for people who people in government that have taken action based upon our action. I hope that this doesn't happen very often. It seems to me that it's not good for us to so quickly reverse our. I will be voting to reconsider, but I think it's not. It's not the very best thing that we can do. So I think it's okay, but I wished we would have just been patient and declared it in a different way. But that's my opinion at this point. Thank you.
Thank you, Commissioner Helserman. Commissioner Drick, you have anything on this round of comments, questions?
Nope, nothing.
All right. I want to go ahead and address some issues. You know that it was reported. I saw a comment referring to our decision, you know, tonight as the big lie. You know, basically denying that COVID exists. I disagree. COVID does exist. What I do disagree with is the policy positions of specifically our governor in addressing, you know, our governor, if you might recall, decided to put COVID positive patients in nursing homes, a move that put the most vulnerable at high risk. That is unconscionable. I also disagree with the policy where the governor has decided to use social factors, not medical factors, to deny our seniors in Livingston County an adequate supply of vaccine. We have, I heard two citizens comment on that having to go out of county. And I just want to reiterate that that is a decision of the governor to rank Livingston County as 83rd out of 83 counties in priority. As I stated earlier, I'm very happy to hear that Ms. Suarez Forward has finally got a vaccine, and and God bless her and her husband. You know, there's other policy decisions, you know, allowing illegal immigrants to come into our country without being tested for COVID, you know, spreading COVID, you know, so yeah, I don't say that COVID doesn't exist and it's a big lie. I say some of these policy decisions need to be re-examined. With respect to some local things, somebody mentioned immunocompromised people on the Planning Commission. I've read the statute regarding open meetings, Public Act 267. I've read it many, many times. There is the ability till the end of the year, till the end of December, to allow medical, you know, public officials to attend virtually for medical conditions. So on the people that are immunocompromised, I clearly see that as a medical condition. If they want to attend virtually, they need to attend virtually. I fully support their ability for medical conditions to participate virtually, and it's allowed by the Open Meetings Act. You know, I was initially told that cities could not declare an emergency. That was found out to be wrong. You know, my antenna goes up when I am provided information that subsequently it's black and white in my mind. You know, it wasn't like there was any interpretation, but finding out that no, you could do it as a city. You know, it makes me question everything about a resolution. You know, I do feel for our local municipalities, you know, making this decision late, you know, on the day before, 2 days before the deadline. But I would also say that our local municipalities also knew back in December that this could happen. And so there is some responsibility there, at least in my opinion. You it was mentioned during the discussion and debate, that these are commissioner meetings, meetings of the county commission, which I agree on, but more importantly, these are meetings of the citizens of Livingston County. Some citizens want to participate in person, others want to participate virtually. I think, to address Commissioner Reeder's, that we will do both. And moving forward out of this pandemic, maybe this is a silver lining that we will. I think as a matter of business, because I'm submitting a rule change that I'm positive will be, a board rule change that I'm positive will be embraced by all commissioners, that we will be doing in-person meetings, but we'll also be I'll call it simulcasting on Zoom. So in my mind, we do the best of all worlds. We accommodate those citizens worried about, government infringing on their rights. We address the needs of citizens that are more concerned about COVID and don't want to attend in person. I think we accommodate everybody by rescinding this order and implementing the plan that I just mentioned with respect to virtual and in-person meetings. I see I'm over my 5 minutes, so I'm going to yield the floor and ask if there's any follow-up comments before we take a vote.
Mr. Chair?
Commissioner Lawrence.
As I mentioned earlier, because of our partner municipalities scrambling, because of meetings that have already been scheduled and notified, I'd like to make an amendment that we change the date from May 31st to April 16th to accommodate those that were led to believe that there was going to be a local state of emergency. And when that expires, we can resume normal business and have the hybrid opportunity for the public.
Commissioner Lawrence, here's how that would work. The motion to reconsider is just that, a motion to reconsider. It cannot be amended. When we, if you want to put forward a motion to have the date, I forget the date that you said, but in mid-April, it is my understanding that that motion could be made, but that it didn't go through committee. It would require support of 2/3 of the commissioners.
I'm looking at our legal counsel who is shaking his head, Mr. Chair.
Yes, so I'll call on Mr. Nordford.
Mr. Chair, may I assist? This would be in order in the event the motion to reconsider passes. So at this point, the discussion of the amendment, it would need to occur, and whether or not Commissioner Lawrence makes the motion to amend only after we conclude the vote on the motion that is on the floor, which is the motion to reconsider. At which point, whether it is amended or not, when you're considering the resolution, you basically go back in time to where things left off the last meeting, which is that there was a motion to pass the resolution with support. And an amendment could be made at that juncture and voted up or down, or the resolution could be voted up or down, just as it was previously at the prior meeting. But first things first is the issue of the vote on the motion to reconsider.
Thank you. Does that answer your question, Commissioner Lawrence?
Yes, it does. Thank you very much.
Other questions or comments? Hearing none, take a roll call vote on the motion to reconsider the decision. And just want to be clear, if the reconsideration motion passes, we're going to take another vote on the original motion of declaring an emergency, which council has said is amendable. With that being said, Roll call, please.
Commissioner Plank,
Yes.
Commissioner Lawrence,
No.
Commissioner Reader,
You're muted, Commissioner Reader.
I apologize. Yes.
Commissioner Nakagiri,
Yes.
Commissioner Helserman,
Yes.
Commissioner Dreck,
Yes.
Commissioner Zajac,
Yes.
Commissioner Griffith,
No.
and Commissioner Gross.
No.
Motion to reconsider carries.
So the motion to reconsider carries. Now we I'm going to ask for clarification from council. Do we need a motion to vote on the original motion? Is that?
No, Mr. Chair, at this point, because the reconsideration vote passed, you are at the point where the original resolution in the form that it was made is on the table again. So you have a motion to approve resolution 2021-03040 that has been seconded. And so at this point, you are back to all your original options: debate, amendment, refer to committee, have a vote.
All right. Any commissioners wish to address or comment or address this issue?
Mr. Chair, at this point, I would like to make an amendment on the original resolution that it extends through April 16th, period. This will allow our departments, this will allow our partner municipalities to do what they need to do to conduct business.
Clerk Huntley, do you have the?
Just to clarify, the language in the last, be it further resolved that due to the prolonged nature of this event, this emergency declaration may remain in effect until April 16th, 2021. And Commissioner Lawrence, that is exactly where that sentence would end.
That is correct.
So we have a motion to amend. Is there support?
Support Griffith.
Support from Commissioner Griffith. And any discussion?
Mr. Chair, if I could, please.
Commissioner Zajac.
Though I too understand the predicament that we've put our municipalities in, but they're not without recourse. The Emergency Management Act allows for the chief executive official or an emergency manager to, on their own, without calling a quorum to vote, to issue a local state of emergency if they so choose. As far as I'm aware, the only two bodies that'll be meeting in the very near term have already decided that they would issue a local state of emergency. And I don't believe that we've cured the issue with the rationale for why we would issue such a state of emergency. The state of emergency must be present for us to then act in any sort of different manner than a true in-person public meeting. I'm 100% supportive of having the public attend virtually, because the Open Meetings Act addresses addresses meetings of the elected body, which is us or our committees. So that also would allow, there's no restriction on the local municipalities voting for their own state of emergency, and there's no restriction on, in accordance with the Emergency Management Act, the chief executive official making a declaration. I think there's plenty of time for them to do that if they believe they need to in a short period, which would allow for then a meeting to occur. And most importantly, I don't believe that we satisfy the requirements of the Emergency Management Act. Thus, we can't satisfy the requirements of the Open Meetings Act, considering it in this fashion. That's all. Thank you.
Thank you, Commissioner Zajac. Other commissioners with comments regarding the amendment? Hearing none, we'll have a roll call vote on the amendment to have the emergency order extend to April 16th. Was that correct?
That's correct, Mr. Chair.
All right. Roll call, please.
Commissioner Lawrence,
Yes.
Commissioner Reeder,
Yes.
Commissioner Nakagiri,
Oh,
Commissioner Helserman,
No.
Commissioner Dreck,
No.
Commissioner Zajac,
No.
Commissioner Griffith,
Yes.
Commissioner Gross,
Yes.
Commissioner Plank.
No.
Motion to amend fails.
so we're back to the main motion to have the we're back to the main motion, and any further discussion regarding the motion to have a emergency declaration?
Point of clarification.
Commissioner Drick.
So it's back to May 31st if we vote yes.
Correct.
Got it. Thank you.
I'm sorry, Mr. Chair. Mr. Chair.
Yes.
A yes vote would be to declare a local state of emergency. So a no vote would put it back to May 31st.
That doesn't make sense.
No, you mean March 31st.
I'm sorry, March 31st. I've said the wrong date. So I apologize. I misunderstood the question. I just wanted to make sure that we knew that the resolution, and this is my fault, I heard the date incorrectly. So the resolution is as it was originally passed, back on the table with a motion to approve the resolution that's been supported, and a yes would be to approve it, a no would be not to have an emergency state of emergency.
Correct.
Commissioner Drick, I apologize. I heard the wrong date there.
No problem.
Other questions, comments?
I have a question, Reader.
Commissioner Reeder.
Like to ask council, I don't believe there's anything in the resolution as it's been presented that would say specifically that the public would be allowed to do Zoom meetings or virtual meetings as well as appearing in public.
Yes, that is correct. However, that is within your purview as a board, whether or not you want to permit that. That is not something that you would need to pass a resolution, in my opinion, to permit. It is available to you to do that.
Okay, so we will do that even if we were to get rid of the emergency.
You could, yes.
Let me address that also. I have been working on and actually today finalized the resolution. I haven't distributed it to change the board rules, so we memorialize in writing. So we don't have any gentlemen's agreements. It's memorialized in writing. It's baked into our board rules that we will have hybrid meetings. You know, the board will meet in person. The citizens can meet in person, or they can meet via Zoom. And I plan on, with the permission of the chair of the General Government Committee, proffering that resolution through the General Government Committee and then on to the full board. I am also anyway. That is the plan. And I just wanted to make sure all commissioners knew that. You'll see the exact wording of the resolution along with the proposed change. Well, you'll see the exact word of the resolution shortly. So, but I assure you that it addresses the issue that Commissioner Reeder is concerned about.
So then my only other comment would be, what do we do between now and then? Are we going to allow the public to be virtual?
Commissioner
Mr. Chair.
Zajac, go ahead.
Mr. Chair, my meeting, I believe, is the first one up, and I will be instructing notice to go out for a in-person meeting of the committee members of the General Government, Health and Human Services. And my intent would be to instruct also a Zoom link so that the public can attend virtually as well for Monday, April 5th.
Other questions, comments?
Mr. Chairman.
Commissioner Gross.
So if we do away with the requirement of virtual meetings, and in effect, go to in-person meetings, does that mean that our Finance Committee meeting and our full board meeting on April 7th, that all 9 of us will be required to be there, or does it only require a quorum of 5? And then how are we going to determine who's going to show up?
I saw Mr. Norford wave his hand. I'll let him take the first crack at your question, Commissioner Gross.
Commissioner Gross, unless you have a reason that comports with the Open Meetings Act, which after the 31st, absent a declaration of a local state of emergency, requires either a medical reason or military duty absence. In order to participate in the meeting and vote, you need to be physically present.
So that would require all 9.
Yes.
To the extent that no one has another exemption under the Open Meetings Act.
Yeah. Okay, thank you.
Anybody else?
Mr. Chair, I think I just need some clarity here, and I'm sorry. So what you're proposing to do is change our board bylaws to include Zoom meetings with the public? Is that what I'm hearing you say? That we would vote on that?
Not tonight.
To accommodate, well, through, I guess, public safety, or Health and Human Services, or Commissioner Zajak's commissioners meeting. That's what we're going to do. I'm a little bit confused. So what we're going to do is accommodate our board rules so we can have the public meet with us virtually. Is that what you're proposing to do?
Well,
That's what we would vote on?
Yeah, so the chairs of the committee they have the authority to accommodate, the public via Zoom. The committee chairs have that. What I'm proposing is to take away the discretion of the committee chair so that we always have both in-person and Zoom meetings, because it will be in the board rules.
I mean, I don't have a problem with that. I would like the public to have the ability to Zoom, but I guess I'm just trying to think. So that changes the board rules. I don't know if we've ever done that before. Well, we usually vote on those at the beginning of the year, I guess. So, okay. Thank you for the clarity, I guess. Okay.
Mr. Chair, I have one question, please.
Sure, Commissioner Lawrence.
Let's take this to Brian John Keir's office, the Drain Commissioner's office. He has a public hearing scheduled for April 1st, I believe.
Commissioner, tomorrow, I believe.
No, he has one on Thursday, April 1st, which he has already sent out notice. So my question, that's why I wanted to say that, that's why I made that amendment to the 16th, which failed. But my question is, can he, as a public body, hold a in-person virtual public hearing at the Drain Commissioner's office on April 1st.
I'll let Mr. Nordford unmute himself and.
So that depends. The two criteria under 15.263A are to permit the electronic attendance of a member of a public body who resides in the affected area, or to permit the electronic meeting of a public body that usually holds its meetings in the affected area. So if their meeting is held in a jurisdiction that is under a local state of emergency, they could have a 100% virtual meeting. I don't know where that meeting site is planned. I don't know if it's in the city of Howell, if the city of Howell has declared a local state of emergency, but it would be possible under the application of the act for that public body to do so.
Right. I'm just trying to be courteous to our fellow municipalities and our staff who had things in the works.
Mr. Chair.
Anything further, Commissioner Lawrence?
No, thank you.
Commissioner Zajac.
Sorry, Commissioner Lawrence. The Zooming is catching you off guard here, or catching me off guard here. I spoke with Drain Commissioner Jonkier about the two meetings this week. The first meeting is tomorrow. That's the large hearing where he doesn't know how many people will attend because it's the public providing input on the special assessment. The feedback I got from Drain Commissioner Jonkier with regard to Thursday's meeting is it's a much smaller meeting, and generally speaking, there's not much attendance. And I also understand that he noticed both a public location in his office as well as the Zoom link. So my understanding from that takeaway was that the voting members of that body would be in person, yet the public would still be able to participate virtually, as we've just discussed, for our meetings going forward.
Okay, thank you.
I have a question, Mr. Chair.
Commissioner Helserman.
For council, let's say person 26 enters the room. What does that do to the state of the meeting or the state of the ability to have business conducted?
It depends on what the person chooses to do, and two, what additional accommodations the board may have set up. So if the person cannot enter the meeting room and the board has separate accommodations on site to allow for two-way communication and to still have the person sign up for public comment, shouldn't do anything. If the person is told we've reached our room capacity and we also have this Zoom link, if you would like to use Zoom, that's different than requiring, but like to use Zoom and they decide to use Zoom, that's not an issue. So it's possible it'll present no issue whatsoever. And we'll have to deal with it from sort of a practical standpoint if the person insists on coming in, just like we would if we reached capacity under the building code or some other issue. So we should be able, from a practical standpoint, to address it. A very strict reading of the law may be that we need to have, a monitor set up in another facility that nearby, in the hall, in another room, something like that.
Okay, but I would assume that our boardroom has a limit, a number by the fire department or whatever, whoever sets them. And let's say it was 60 or 70 or whatever it was, and we had 75. That in itself would not make any votes taken in the meeting null and void.
Well,
that's kind of my question.
I don't want to get too technical on this, but you cannot bar somebody from a public meeting. So even in your scenario, if it's a capacity limitation based on an order, where, a building code order, we would want to keep the doors open. We want to make sure they could hear. It's It's just making sure that you're operating in a way that still allows people to practically have a say if they want to make public comment and hear what's going on.
Okay, so
in a technical sense, that could mean going to a bigger room or recessing the meeting until you have another space figured out, or moving the meeting outside. So if we're getting into uber technical interpretations of the Open Meetings Act, which we generally don't have to do, but
Okay.
if for the sake of a hypothetical, yes, we can't bar people from a public meeting.
Sure. Okay, thank you.
Any other commissioners who haven't spoken to the issue wish to speak? Hearing none, I think we're ready for a vote.
Commissioner Gross.
No.
Commissioner Plank.
No.
Commissioner Lawrence.
No.
Commissioner Reeder.
Commissioner Reeder?
No.
Commissioner Nakagiri.
No.
Commissioner Helserman.
No.
Commissioner Drick.
No.
Commissioner Zajac.
No.
And Commissioner Griffith.
No.
Motion to adopt the resolution fails.
Thank you. We're at item 9 on the agenda, which is the second call to the public. If is Cindy Katnick still with us? Yes.
I'm still here.
Cindy, if you would be so kind to, call on folks that are interested in speaking at the second call to the public. If there's anybody interested, please raise your hand. Would remind you, that there is a 3-minute limit, and we ask that you give your name and address before speaking.
Therese Cremani?
Hello. Okay, I wanted to make sure I was unmuted, etc. I wanted to let the board know that in the last 2 days, or last week and today, I've done my best to do my due diligence to reach out to our other municipalities, all 20, and have had the opportunity to speak with them either in person, email, or both. The one thing I want the board to know, and also the communities, and I did explain this to them, is that the emergency declaration option is a key to allow them to continue to do government business. It's a tool. That tool, it's not a black and white issue. It's not an all or nothing. This tool can be picked up at any time. The need arises. It's always an option through the end of the year. So for whatever municipality does not wish to take part in that option now, in another month, in 6 weeks, in September, up through the end of the year, still have the option to do that. And I will continue to work with those municipalities who need that assistance. That also includes the county, if for some reason the board feels that there is a need. So I wanted to make that clear. Also that we currently have 6 municipalities who have struck out on their own and have gone ahead and declared. And those, they've set various expiration dates for that, and those will be monitored by me. So I just wanted to give you that quick update on that and let you know where we stood with that. And that's all I had. Thank you.
Thank you, Ms. Karani.
Kate Derozier?
Thank you. I want to convey how disappointed I am on behalf of the library, frankly, that we are back to what we'd hoped we'd avoid by having to meet. And by doing so, I just hope you've all considered that you will need to wear face masks in addition to being distanced in that room, it is very hard to conduct meetings wearing a face mask and being understood by people who are not in the room and even people in the room. There are some complications to that. Libraries operate in a slightly different way. We're not a municipality and we serve 6 townships. So we're kind of in a bind. We're in a bind in a number of ways, which I elaborated on earlier. I had really hoped to have this declaration in place to give us the umbrella to act responsibly in our community and keep people as healthy and safe as possible. Thank you.
Thank you.
Rick Nieper.
Rick,
Rick.
you're muted.
There you go.
I was having a little trouble unmuting here. So I just want to say that, you know, this is an awful lot to, I guess, you know, have 2 meetings to figure this stuff out. And it's kind of ridiculous. It's obvious that my commissioner, he's not representing the people and he's scared to death of his own shadow. I don't know why he would be seeking advice from township municipalities because he can't make a decision for himself, I guess. So I don't know. It's just been kind of a circus, I guess, for lack of a better word, trying to keep my language clean. So that's all I have to say. Thank you.
Thank you.
Jessica Garcia.
Can't see it. Bunch of stuff.
Hi, thank you. I just would like to acknowledge the comments. Could somebody mute Rick, please? Thank you. I would like to acknowledge the comments from Commissioners Gross and Griffith. Thank you for your sensible responses tonight and your compassionate responses tonight. I also want to acknowledge Commissioner Lawrence for her effort to accommodate the municipalities who are not ready for such a quick turnaround. This is a clear example of government's inefficiency and dysfunction. These are all things that should have been sorted out long before the last vote, let alone 2 days before this ends. I would like to highlight that all of the calls tonight, and many of the commissioners actually, there seems to be a large consensus that a hybrid approach is really the best path forward. And so I hope that the commissioners follow what sounds like their intention to provide the hybrid option going forward. I hope that we can trust that that's what will happen, because I know many of us would like to be able to continue to be engaged with local politics, and this is the best way to make that happen. So I do hope that that carries forward, and I want to thank again Commissioners Gross, Griffith, and Lawrence. Thank you.
Thank you.
Brian's iPad.
Hi, thank you. Brian Rakuta, 7287 Fawcett Road, Fenton, Deerfield Township. So I appreciate the debate and the discussion tonight. What I need moving forward, and I'm sure other departments are going to need, is direction from, whether it come from the board or from legal staff, on how we conduct our meetings. There seems to be some variables, and there's a lot of discussion about that tonight. So, you know, I don't know. I feel like a document needs to be put together to give guidance to those of us who have to operate meetings within the county, and not necessarily other municipalities, but for myself, I'm just looking for guidance for how to move forward. Thank you.
Thank you.
Cindy.
Hi. I just want to say thank you to the Livingston County Commissioners for reconsidering ending the state of emergency at the county level. This action will allow for those who wish to attend open meetings in person and will also allow those who want to stay home and attend meetings by Zoom. This action will satisfy concerns of all Livingston County constituents. I really appreciate you guys taking the time to come back in and redo this vote. I feel that that the right action was taken today. And I think it's a step in the right direction toward bringing some sense of normalcy back to our communities. And I appreciate you guys very much. Thank you so much. Have a good evening and God bless.
Thank you.
Farrell?
Hi, Stacy Farrell, Osceola Township. I just wanted to make a point with regards to the confusion regarding how the meetings are going to be held from now on. Extending it for a couple of weeks would have given that latitude. But I'd also like to comment my appreciation for the majority of the commenters tonight that were able to handle themselves appropriately. And particularly for this second round, that doesn't mean Rick. Thank you.
Thank you.
Rebecca Foster?
Hi, Rebecca Foster, Village of Pinckney. I know this isn't actually how it works, but I would like to offer the Village of Pinckney as a location for virtual meetings for any of the entities that have been left in the lurch by this decision by the county this evening. If you can find a loophole in how to notice and hold your virtual meetings in the Village of Pinckney, please contact me. It's r.foster@villageofpinckney.org. Thanks.
Thank you, Ms. Foster.
Elizabeth Johnson?
Hello, I just want to thank all of the commissioners for taking time. And I think really in a time when everybody is having a struggle with their faith and trust in government, that I think that the county commissioners coming together and saying, okay, we need to reconsider this. Maybe we made a mistake. I really, really respect you guys for this effort and for making further discussion of this and moving forward to start our community on the path back to normal. I know it's going to be hard work for a lot of people, but I think that it's needed work and we need to get back onto the right path to being back to normal. Thank you so much.
Thank you.
Aaron Wilson?
Greetings once again, sirs and madams. Even though I'm not in the Livingston County area, in Ingham County, actually, the epicenter of all this mess, I decided to attend because I feel strongly about issues like this. And I want to thank every single one of those commissioners that voted to get rid of the state of emergency. And I hate to break it to the ones who voted to keep the state of emergency in place. Common sense prevailed. Intelligence prevailed. And that's what needed to happen. Some of the commissioners on the panel agreed that, wait a minute here, maybe we made a little bit of a mistake. And they actually used logic. That's what's needed around here. That's what a commissioner's made of. And I'm sure even members of the general public, as well as some of the commissioners, know that. So I wanted to express how grateful I am that this kind of decision was made, and it's going to set the standard that there didn't need to be a state of emergency declared when there wasn't one, and there clearly isn't one. I just want to say thank you all for that. And you all just realized masks and social distancing nowadays, they may be a household word right now, but so is garbage. And it stinks when it gets old too. I'm Aaron Wilson. Thank you, sirs and madams.
Thank you.
Hello, Rob Rodriguez Pellizzari, 8209 Robbins Drive. I would like to thank Commissioner Plank and Commissioner Reeder for reconsidering their votes. I think for all the commissioners that have voted on this and chose to rescind an already existing resolution, it showed incredible courage, and it showed their wherewithal against some really strong criticism. So I commend you all and what you've done. I really hope that we can all work together to create this hybrid style meeting that's going to make everyone be able to participate. And I, along with my production company, will be willing to help you to make that possible should you ask for our help. Thank you.
Thank you.
Caitlin Perry, Dial.
Hello, Caitlin Perry Dial. I'm a Brighton District Library trustee. First of all, I want to say that I'm disappointed that the emergency declaration was rescinded, but I am thankful for the thoughtful discussion. I particularly want to thank Commissioners Griffith, Lawrence, and Gross for their outward thinking, that it is not just the county commission meetings that would be affected by this, but the smaller municipalities. Thankfully, the Brighton District Library meets in the city of Brighton, which the city of Brighton has declared their own state of emergency. So we will be able to continue conducting our meetings virtually. However, I feel for my colleagues at the Heartland District Library in that they will not be able to continue to conduct their meetings virtually. I also want to say, though, that I am really thankful that Commissioner Nakagiri is considering this new rule to allow a permanent participation of the virtual public in future public meetings for the county commission. I think it's fantastic. And I think that it only allows for greater transparency of our county government. So I look forward to that discussion and that vote. And I'm thankful that that is already underway. So thank you.
Thank you.
Is there anyone else from the public who would like to address the board? Please raise your hand, wave your hand. I see you. Nancy Durant.
Thank you. I'd like to just thank the people that have spoken on behalf of continuing the resolution. I think Commissioner Griffith and Lawrence and Gross were very apropos in what they expressed. I'm disappointed that the resolution did not continue. I am thankful that we are going to go ahead with hybrid options. I would like to see a resolution that's formalized so that that is occurring. I will hopefully be able to attend in person as I have done in the past. Based on my work situation, I'm not sure how often that will occur, but I hope to be able to do that in a hybrid fashion. I would also want to make sure that everybody does attend with masks. We do have a lot of the variant strains in the county. I double mask. I encourage people to make sure that they're wearing N95s to make sure that we are not spreading the virus. And I'd also like, people had said that commissioners would be voted out if they are not supporting, this resolution. People don't realize, but there is a huge number of healthcare professionals that are in this county. Just within this county, there are between 4,000 and 5,000 people that commute down to Ann Arbor to University of Michigan for healthcare professionals. I'm commuting right now 55 miles a day to help with vaccinations. So please, please support our healthcare people. Please respect them. Please mask up. I know I see people in Target and Meijer that are without mask, but please respect our healthcare professionals and mask up. I know some of you don't believe in the virus, but it is out there, and our ICUs are filling and hospitalizations are increasing. Thank you.
Thank you.
Jessica Hamlin.
Hi, my name is Jessica Hamlin from Osceola Township, and I would just like to say thank you to all the commissioners who decided to vote no, and for Commissioner Plank for bringing this to rescind. I just want to say thank you, and I want to give a shout out to Rick. You can keep speaking your truth, Rick. Masks do not work, but that will be a topic for another day, and I look forward to working with you all soon. Bye. Thank you.
You.
Gianni Kazan.
Hi, I apologize. I'm driving home from a long day of work in Lansing. So it's not a question of driving. I want to thank you for listening to all of us. I want to thank you for having the courage to put Livingston on the state map, that you do believe we don't need parents to govern our state. First of all, we are parents. We need to have our right to make decisions for ourselves if we're going to attend one way or another, and we would like that option. We'll have another discussion about masks and about everything else. That fear tactic is never going to work. But I want to thank you for reconsidering, for listening, and any, as a physician, I am more than happy to help if I can, and maybe see the other side of the story, because it's not all one-sided, as we well know. And maybe that's what we need, more voices on the other side rather than just the media and the overwhelming pharma voices. So I appreciate you so much, and please feel free to reach out to me.
Thank
Danielle. Danielle.
I would just, yes, thank you. I would just like to go ahead and I stated my address before. I just wanted to go ahead and say thank you to the commissioners who decided to make the change and end the state of emergency. And for the departments who weren't well prepared for this, there was some good points made that this should have been considered and been thought of, even just the thought, even some sort of temporary plans put in place, knowing that it might come up. There might be a day, there might be a time where this might end and they would have to do something different. So really that's an accountability issue, in my opinion. And I'd also like to address how people are pushing masks heavily on here. N95s have to be fit tested. Every healthcare employee, I used to work at a hospital in Ann Arbor, and I actually fit tested people. N95s have to be fit tested. If you're not fit tested, you're probably not wearing it properly, and therefore it isn't effective. Also, the virus that we're talking about here, and I'm not saying the virus isn't real, it definitely is a 0.124 micron, and N95s only cover down to a 0.3 micron. So they're not really as effective as everyone says. They're very small. It's aerosol particulate. They're not large droplets. So there's that. And if we were in such a heavy pandemic, the Beaumont system wouldn't have laid off over 2,000 employees. I know nurses that have been laid off. I know doctors that have been laid off in the middle of the pandemic. So just putting that out there. Again, I would like to say thank you for allowing me to speak, and thank you for your decisions.
Lynn.
Hey there, Lynn Vogel, 415 Northeast Street. I wanted to echo the thanks. Oh, pardon me, just a moment. My children's bedtime alarm is going off across the house.
Bedtime is in 30 minutes.
Okay, where was I? I noticed body language from certain commissioners who were pushing for extensions and trying to help out all municipalities, and I feel that body language of despair and annoyance and final resolution in my soul. So I thank you guys for actually taking the time to talk about it, and the hybrid meetings I think is a good push. I'm glad that it's going to be written in, and as for people with their expert knowledge and medical advice, really it's a matter of masks work. Thank you.
Thank you.
Is there anyone else from the public who would like to address the commission? Commissioner Nakagiri, I do not see any other hands.
Yes, I don't see anybody else. So I'm going to go ahead and close the call to the public. But before I ask for a motion to adjourn, I want to publicly apologize to all of my commissioner colleagues. When Commissioner Gross was getting attacked, I should have ruled the attacker as out of order and cut him off. I apologize that I didn't do my duty, and it's not going to happen again. Overall, I thought the bulk of the vast majority of the discussion was very respectful. There were ideas exchanged. Obviously, not everybody agreed. There were people on both sides of the issue, but I am thankful that I live in a county where there's a high degree of respect and consideration for people with various points of view. So with that being said, I would ask for a motion to adjourn.
So move, Helserman.
Motion by Helserman, support by Griffith. Roll call, please.
Commissioner Helserman,
Yes.
Commissioner Drick,
Yes.
Commissioner Zajac,
Yes.
Commissioner Griffith,
Yes.
Commissioner Gross,
Yes.
Commissioner Plank,
Yes.
Commissioner Lawrence,
Yes.
Commissioner Reeder. Commissioner Reeder.
Yes.
Thank you. Commissioner Nakagiri.
Yes.
Motion carries.
Thank you. We'll see you at the next meeting. Thanks.
Thank you.